Good afternoon, everyone. Can everyone hear me?
Yes.
So thank you so much for coming today. I want to recognize some folks that are here. Of course, our Congressman Pat Ryan, our County Executive Jen Metzger, our Public Safety Law Enforcement Chair Gina Hansett, and of course the crew that'll be talking about this program today. And I'm really happy and proud to be up here and really discussing some important stuff that's been going on here for the last 5 years in Ulster County. What we've been tackling has been the reducing of supply and demand during this opioid epidemic. I want to talk a little bit about what that entailed. And that entailed, Commissioner, please come on up. And then this is the Department of Mental Health Commissioner, Tara McDonald. So that has entailed really going after and having the biggest drug seizures in the history of the county, as well as developing teams to really help people out there. Teams like the Opioid Responses County Law Enforcement, Oracle, and what they have been doing. They have been in the front lines for quite a few years now. One of the things that they find out because of them being on the front lines was that 28% of the overall overdoses were intentional. That's huge. That's something we would not have known had we not been out there. And now having this new grant, and we'll talk about that in a minute, we'll have 2 fully embedded teams, one for the substance abuse issue, and then the other one for mental health and behavioral health. That's huge for law enforcement. That's never happened in law enforcement before. These grants are extremely competitive. They're not easy to get. And for the last 4 years, we've been able to get close to $3.1 million in grants relating to this epidemic. And these embedded teams with law enforcement are really going to make a change. Just the word team should really express the importance of what we're doing here. So I'm really happy and proud and thankful, especially this week for Thanksgiving, that we're able to do more with the partners that we have here in Ulster County. Our partners, our federal and county partners. I'd like to introduce our Director of Community Incarcerated Services and author of a lot of these grants, the $3.1 million. Our director, who's been assigned here now for about a year, but been working with these grants for quite a while, Juanita Hotchkiss. And her, the field marshal, if you will, Lieutenant Chad Story. Come on, guys, come on.
Thank you very, very much. So yes, I started my work with Ulster County as the project manager for the Healing Community Study. And so with that study, we were really able to take a community-driven approach to addressing the opioid epidemic in Ulster County. We took feedback, we did all types of analysis of the landscape, of the services that were available, and we looked for gaps, and we looked for ways to address those gaps in evidence-based practices. So with this work, this is really what brought me here to this place with the sheriff and lieutenant in designing what is now, for all of you, our redesigned Oracle team. So our new team, our Oracle team now, with our very first grant, we were able to add a social worker, 2 peers, and a CIT officer for again, a very community-led response to opioid overdose. So this was our opioid overdose response team. The second grant allowed us to also offer more services by including 2 care managers, one specifically for the community, and one for our reentry, our jail reentry. So through this work, we were able to truly not only expand the work that expand with what the sheriff's office was already doing, but we were able to better connect and reach individuals who might not have been reached prior. Not only connect to them, but connect them to the resources that we have in our amazing community. And so with that said, we could talk a little bit about the numbers. So the Oracle stats, and I'm talking about Oracle right now because this really is what led us to where we are today. We learned a lot. So through Oracle, we had about 648 referrals in 2022, not about, we had exactly. 600 of those individuals consented to peer services. So that means that they actually consented to have peer services, have individuals on our team maintain connection and follow up, and whether on our team or in the community. So that's huge. That's the majority of the individuals that we made contact with. And from that, more than half of them were referred to rehab or detox. You know, and these are individuals that are the highest risk of overdose fatality in our community. And our team has been able to go out and make these connections. And we started to learn what the true needs were from the community, because as they're going out and connecting with individuals, they're understanding the nature of the overdose. They're understanding the epidemiology behind the situation. And we began to truly connect the dots. And so this year, we started to track the data regarding nature of overdose. And so when I say nature of overdose, it's intentional versus non-intentional overdose. And so what we learned was about 28% of the overdoses were deemed intentional, meaning that the individual had taken whatever substance very specifically with the intent to harm self. And there's only two ways of determining this. One is a note, and one is by the person telling you specifically. And because we were able to make these very unique connections, we were able to hear these stories and recognize that there was a need for a co-occurring response. This is not just substance use anymore. We're seeing the growth, we're seeing the need, and we need to address it. We worked very closely with our Department of Mental Health to refer just about every single individual that we encountered that needed, that potentially would benefit from services, and that was incredible. And the Department of Mental Health took every single referral, followed up with incredible care and ease, but still we started to see that there was a gap, because a lot of times we have information, phone numbers, addresses, and that information doesn't, the individual isn't always able to be located. And so in partnering again with the Department of Mental Health, we designed and thought, how can we do this better? And so I'm showing you right now up on the screen, this is our 2023 COPS grant. It's a CIT team. The team is to support and advocate through frontline engagement. It is the SAFE team. This team will be making first touch encounters. They will be connecting, assessing, and referring. We are not replicating anything that already exists in the community. We are literally just taking our resources to be able to connect with more individuals in the community so that we can get them into, assess their needs and refer them for services. As you can see, law enforcement is still responding to behavioral health calls. They're coming in through the 911 center. There were, since 2018, 2,340 911 calls that came in, and that were deemed behavioral health encounters. We saw between 2021 and 2022 a 28% increase, just as we saw with our intentional versus non-intentional overdose. So the need was there. So with this, we're going to be replicating and expanding our Oracle model to increase our capacity for a county-wide response to intentional overdose and behavioral health calls. And I'm going to turn this over to Lieutenant Chad Story. He's going to talk a little bit about the CIT aspect of this team, talk about the co-response, how we're developing community partnerships, and implementing this response.
afternoon, everybody. So basically, we're replicating the structure of our Oracle team, which through success, we've developed our new team, SAFE, and support and advocacy through frontline engagement. And first of all, we're going to start with educating our law enforcement officials in the county and outside the county with crisis intervention team training. That was part of our Oracle grant initially, and we're going to continue with this new grant funding. CIT training is a 40-hour block of training and crisis intervention training for law enforcement. It's a full gamut of classroom as well as client forum and community resource board at the end of the training. And then we're going into create and develop our co-response team similar to that of the Oracle team, which will consist of clinical social worker, peer advocates, and CIT trained officers. Developing the community partnerships. We cannot do our job without our partners in the community. Several organizations we've already teamed with the Oracle program, and we're just going to better those community partnerships and engage more of the behavioral health providers in this new grant. Implementation of behavioral health co-response team. Why law enforcement? Like Juanita said and the sheriff said, we are on the front line and we are responding to those 911 calls initially. And you know, most people have been in law enforcement like I have for several years. You know, our frustration has always been go to a call and never have any services to offer. And that's what this team is going to do, bridge that gap and make referrals out to our community partners. And the overall impact is to obviously increase those number of calls to and to law enforcement and divert to the necessary community partners for treatment. And with that, I'd like to introduce Congressman Ryan.
I'm going to introduce the congressman real quick. So we started this over 4 years ago, and at the time he was our county executive. The most unique thing about what we've been doing here for the last 4 years is, like I said, the demand and the supply of the issue that we have at hand. So it was the congressman who hired Juanita Hotchkiss to begin with. And so that's why it's important that we have our federal partners in Washington, D.C. that are going to come and help local agencies like and counties like Ulster County. So I'd like to introduce our congressman, my congressman, and my friend, Pat Ryan.
Everybody in the other counties already thinks I'm biased towards Ulster County, so this is not helping. But no, it's great to be with friends and colleagues and fellow public servants. And Kara, it's nice to see you. I haven't seen Kara in a while. I'm just here to recognize and applaud just the collective work, and now in the incredible opportunity I have to serve Ulster, Dutchess, and Orange, to get to see the complexity of this challenge, to see how others are approaching it. It even further reinforces the vision that started with our incredible sheriff and his team, and Juanita, Commissioner McDonald, and our other public health leaders in the county, has been continued and supported and strengthened by County Executive Metzger. This is a special thing that's happening here. That's what I'm trying to say. And that doesn't happen by accident. It's really working against all the kind of structural factors and incentives in all of our systems to bring compassion and humanity and a healing approach to this epidemic, rather than a lot of the other things that have happened for far too long and are still happening in many other places. When I think about bumping into some of our great folks at Cantine Field and getting trained, my wife and I, on Narcan by our team a few years ago, and you think about that's just one of the many thousands of touches that these teams have had in a human way with members of this community that are saving lives every single day. So to have the opportunity now to be in Washington amidst the dynamics there, we'll just leave it at that, and have a positive, innovative, successful program, and to be able to fight for and deliver additional resources and funds. This recent round of federal funding is part of what's called the COPS grant. It's a federal program. As the sheriff said, it's highly, highly competitive. And to earn that 4 years in a row, in this case $400,000 of federal funds coming to bolster this program through the COPS grant, that is a big deal. It's very rare. And we're going to work to continue that because you're seeing the agility of this program, taking the data they're learning in real time, improvising, adjusting, recognizing the reinforcement for mental health need, which we all knew instinctively, but now have the data to really back that up. So, I really just want to thank everybody here, especially the sheriff. When you first came up with this idea, a lot of people felt like, can we do this? Should we do this? And obviously the success in the data, and really more importantly, the success in the stories of the individuals and the families affected. When you hear those stories, as I think everyone here has, it's powerful, and it is optimistic. It is optimistic in the face of the moment we're in. The last thing I just wanted to say before I either pass it to you or, okay, Juan's in charge. The last thing I want to say, the sheriff talked about the supply and demand. One of the other pieces that's critical here that I've been working on at the federal level is recognizing specifically the growing and deadly threat from fentanyl. And we're working on a bunch of pieces of federal legislation to do interdiction on the supply side, because a few years ago we declared a state of emergency specific to fentanyl. We've only seen the numbers go up, and in particular we've seen the Chinese components and precursors coming from China that have been flooding into our community and costing lives. So one of the pieces of legislation I'm working on and proud to lead is something called the Stop Chinese Fentanyl Act, that's meant at a really global level to try to tighten up that supply that's coming into our community. And we just had another big breakthrough on this in the meeting that President Biden had with Chinese leadership, an agreement to curtail some, and we need to keep pushing on that. So again, thank you all for the work you're doing, and in advance for the work you're going to continue to do, and happy Thanksgiving.
Thank you, Congressman. Of course, I said earlier that we have many partners in government that allow us to do the work that we do. That partnership is extremely important, especially at the county level and the leadership at the county level. And I said this when she was running for county executive a few years ago. She's a visionary, and we're very lucky to have her as a county executive. And I know that we've been working very, very well together since she's been in office, and she just got reelected. And so I am proud to stand here with my county executive, Jen Metzger.
Hi, everyone. So I just want to say just how proud I am of our sheriff's office and our team here, and really a lot of this work, as has been discussed, happened on my predecessor's watch and building up to where we are today, and we owe a lot of gratitude to all of you. I want to thank the Department of Justice for funding this program, and as I said, just give a shout out to you, Congressman Ryan, for all your advocacy. Sheriff, you and your office deserve our deepest gratitude for your dedication to our community's safety and resilience. Your leadership and the Oracle team's efforts are saving lives here in Ulster County, and we are extremely grateful for your work. I see our peer advocates in the back who have been doing such incredible work. I want to give them a shout out back there. We know that this is an approach that works. People need to hear from the people who understand where they are coming from. And so I was so thrilled to see that this is all part of this grant. And, you know, getting these grants is tough, as has been said, and I want to just recognize Juanita Hotchkiss and the rest of her team for always being proactive in securing these funds. And we had a little bit of a tug of war. Maybe it was all in my head when I came into office, because I wanted Juanita on our staff. The sheriff won. But this grant really addresses a pressing need that we have today. As was mentioned last year, we saw an 8.3% increase in non-fatal overdoses and a 28% spike in behavioral health-related calls. This grant will enable us to expand collaboration with our community partners on the ground and make sure that we're appropriately and effectively addressing crises situations that are related to mental health and substance use disorder. Ulster County is really, you know, a pathbreaker in really trying to address the root causes of so many of the calls that you are called upon to respond to. And, you know, we're creating, Sheriff Juan Figueroa and his office they're creating a national model, and we have to change direction, and they are shining a light on the path where we need to go. When I came into this office, addressing the mental health crisis was among my top priorities. The grant and this new team that you're creating, it's all of a piece. You know, we are going to be completing our crisis stabilization center, started before I came in, but this will be done next year. We're trying to expand the capacity. We have expanded the capacity of clinical support for youth in schools and outside of schools. We have to be reaching as a county with mental health support in all of our efforts. It's just so connected to everything that we do, every crisis that we face. So again, I just want to express my extraordinary gratitude to this office, and just know that I'm behind you all the way and will support your work in any way I can. So thank you very much.
Thank you, County Executive. One of the things that when we started this several years ago, is this the role of law enforcement? Or is this the role of mental health folks? And some folks would say, and I'm sure I'm going to get a chuckle by some up here, is, you know, is this your lane? And the response that I got when I heard that was, it's our highway. It's our highway. And the only way we can fix the issues, or at least address them, is to work as a team. And I am so lucky to work with the next speaker, the Commissioner of the Department of Mental Health here in Ulster County. And we are huge partners with her. All of these grants are not possible without the County Exec's Office, without the Department of Mental Health, and of course, our legislature. So I'd like to bring up the Commissioner of the Department of Mental Health, Karen McDonald.
Thank you so much, Sheriff. I apologize for my tardiness. There was a little bit of confusion on my part about what time this was going to start, and I was working and polishing up my remarks, and I left them. So I need to speak from the heart and give my appreciation and congratulations to the Sheriff on obtaining this grant. I know completely how competitive these are. You have an incredible team. It is a pleasure and an honor for the Department of Mental Health to partner continuously, collaboratively with this office, and we look forward to extending that through the implementation of this new grant. So thank you.
Thank you. So our last speaker is a member of our legislature, but I want to talk about the whole legislature as a whole and their important role in the overseeing of all elected officials in this county and everything that occurs in our county. And we cannot do it. When I apply for a grant, I have to get their permission. When we receive the award, I have to get their permission. They're a huge part of what we do. And representing the legislature is the chair of the Law Enforcement Public Safety Committee, Gina Hansen.
afternoon. Thank you, Chair, for asking me to be here, and congratulations to your whole team. Ulster County has long been on the forefront of dynamic law enforcement policies, from our nationally recognized Oracle program to our comprehensive training for urgent and SRO participants. This historic investment from the federal government demonstrates the commitment by our law enforcement partners to addressing behavioral health disorders and mental health crises in a safe manner for all. This will allow the Sheriff's Department to advance community policing, hire additional personnel, receive more training, update equipment, coordinate efficiently with our municipal police departments and law enforcement partners, and keep the public informed and involved on the best practices in policing. I look forward to seeing this program expand, save lives, and urgently address our ongoing mental health crisis. I am proud of all this department represents and their commitment to forward thinking for all of our residents. I know that this program, just like Oracle, will be a model across our state and across our nation. And I just think today is a perfect example of how government should work. All the pieces coming together for the better for our community. Thank you.
So again, I want to thank everybody for coming here, and of course, I'm very thankful, especially this week with Thanksgiving coming up, and I want to wish everyone a great, bountiful Thanksgiving holiday. We'll open it up for a few questions, maybe 5 minutes if anyone has questions. If not, we're going to move on.
Sure. How you doing?
Then you're going to have to speak up, Judge.
Okay. So this grant's $400,000, and what exactly is that paying for? Where the personnel who are going to be hired for that $400,000?
Director?
So it's $400,000 over 2 years, and again, we will continuously be able to apply for this type of grant funding. And this funding will cover a clinical social worker who can make clinical assessments upon their response to our referrals and calls, and to make referrals into the community. And we will have a mental health peer advocate. So that is what this grant will cover. And a CIT officer. I do apologize. And there's that.
And this is to respond to, as opposed to Oracle, which responds to overdoses, you guys will respond to behavioral health calls, or an intentional overdose or suicide attempt or something of that nature?
Absolutely. So we're going to be phasing it in. We're going to initially respond to that 28% I mentioned earlier, or we mentioned earlier. So the intentional overdose calls, we are already responding. So this will just allow us to make first touch, first contact, and make the proper assessment and referrals to our community organizations. So we'll start there. But yes, these will be, this team will be available to follow up with all behavioral health calls, and in some cases, they can co-respond, obviously depending on the situation. But this is our phased approach, so we're just walking it in with follow-up to our intentional overdose calls.
Thank you.
Thank you.
Hi. Does this overlap, or how does this work with the existing crisis services that are in place?
That is an excellent question. So we actually wanted to reach more, we wanted to connect more people to services. So when we started to look at the numbers, like I said, between 2021 and 2022, we saw a 28% increase in our behavioral health encounters that law enforcement officers throughout the county were experiencing. So really this allows us to connect more people to crisis services, because we are going to be following up with these individuals. We'll be connecting with these individuals, be able to make an assessment and a proper referral to the community resources that already exist. So we are not reinventing the wheel. We're just making another touch point, a no wrong door approach to helping individuals, especially individuals in our community with co-occurring disorders. So this is really going to enhance our ability to connect to crisis services.
So not everybody, obviously, that's coming in with a mental health issue is coming in to law enforcement.
Yes.
So where does the sheriff's office come in there?
In that case, I mean, you can certainly, we do have a hotline. So if someone wanted to make a referral through our hotline to just get help, our hotline is going to be open up to all, now. Right now, it is specifically for substance use, but if someone wants to make a call, our team has been dedicated from day one to never turn away an individual in need of help. So that's, sort of been their mission from the beginning. And now we'll just be able to formalize it, and we're going to have the skills, the team with the skills to be able to address these growing needs.
So to your point in terms of the folks that are not necessarily getting the first touch from law enforcement, we still have a fully active mobile mental health team in the county that would be supporting those folks as well. This is an ongoing, as the sheriff said, they're phasing this in. We need to continually be at the table between these teams to make sure that there's coordination and no duplication. And we're continually watching the gaps as they come up. But right now, it seems as if the sheriff's team will be focused on that 28% that is coming directly to the attention of law enforcement. If I have that correct. Okay.
Do we have any other questions? All right, well, thank you very much. There are some folks here I probably forgot to acknowledge. I want to acknowledge Dr. Tim Hunt from Columbia University, and I also know that members of our mobile mental health team are in the back, so thank you all for coming, and we recognize you and look forward to working with all of you collaboratively in the future. Thank you. Happy Thanksgiving.